Hi, my name is Havala Broadhead. I am a family nurse practitioner and the owner and medical director of Hearthside Medicine Family Care in Bend, Oregon. I am a mom of a 3-year-old and a 5-year-old, Ruby and Michaela, and I have a very supportive, amazing co-owner and husband who's also a nurse practitioner, Jeremy Broadhead. I have been asked today to speak very briefly on a very broad but critically important topic, trauma, and how stress hormones play a role in our overall health and well-being. So I'm going to be talking about the impact of trauma and the stress hormone cortisol from a primary care perspective and what I frequently see as a provider in primary care in terms of health and how it may relate to the stress hormone cortisol, and then also what we can do and what I aim to support my patients in doing to reduce that hormone and reverse some of those detrimental effects and just live a higher quality life. So without further ado, let's talk briefly about the weight of trauma. So for starters, I am a family nurse practitioner, so I am certified in family medicine and also acute care medicine, and I am trained in integrative medicine, so that is the bridging of holistic medicine with conventional medicine. And I really believe in the importance of science and evidence-based medical practice, so involving modalities in my patients' care that have been shown to be safe and effective, and taking into account the whole person. So not just treating the symptom, but looking for the root cause of the issue, which often does come back to unresolved stress or a background in trauma for my patient. I also really believe in the mind-body-spirit connection, and that we can't treat the body without acknowledging the mind, and vice versa. We can't treat the mind without acknowledging the body, and that it's intimately connected. So I have a background in as a nurse before I became a nurse practitioner, working in ER, ICU, maternal child health, women's health, men's health, and now doing family practice. I care for everyone from newborn babies to grandma and grandpa, everyone in between, and also do a lot of LGBTQA community and beyond care, including transgender care and hormone care. So I want to talk really briefly about the diversity of trauma, and also share with you my own personal experience with trauma, because I feel like that is important to highlight, that I understand trauma on a personal level, which is also why I'm so passionate about this topic. So the diversity of trauma, for me, that means that trauma has many different faces. Just like each and every one of us is unique, each and every person's traumatic experience will be unique. And often when we use the word trauma, we might initially think sexual trauma or physical abuse, verbal abuse, but I try to remember that what may be traumatic for me and may have been traumatic for me may be very different than someone else's traumatic experience. Just as a reminder that of the diversity of trauma. Trauma can be everything from neglect and abandonment to PTSD from perhaps being involved in war or combat area, or living in that area, or witnessing something or being involved in something that was traumatic, like a humanitarian crisis or a natural disaster, or witnessing a car accident or being part of a car accident, having a traumatic birth experience, having perhaps losing a family member or a loved one, gender dysphoria, and not being in an environment or a family or maybe a community that supports that, or your gender identity. Also work-related trauma, which goes under that title of vicarious trauma. So perhaps something that you're witnessing or supporting your clients or patients in, if you're a caregiver or a health professional. If you hear lots of interesting sounds in the background, it's because I am at a campground on family vacation, and there are people actively setting up their tents and RVs next to me. So that's what that funny sound is. Further with trauma, I want to acknowledge racial trauma and discrimination, the issue of immigration and refugees and those seeking asylum, on and on. Trauma is really diverse. For me, my traumatic experience stemmed from a medical situation in which I was hospitalized, and I was told that your muscles are rapidly disintegrating. You have a condition called rhabdomyolysis, the breakdown of muscle tissue. We don't know what's causing it, and it might be autoimmune, but we really don't have any way to treat this, and you might have just 6 months to live. And after that experience, I developed pretty intense panic attacks, including daily panic attacks that were debilitating. So somehow that medical situation resolved itself over the course of about 2 weeks, and I was discharged from the hospital, and my body was fine and intact, but my body remembered and my mind remembered something on a much deeper level, which was the traumatic experience of having a rare medical condition that no one knew how to treat, and being given 6 months to live, when I was in my mid-20s. And so after that experience, I gave myself a little bit of time to recover, and then took a job working in a very intense trauma level 1 ER, and as a nurse, and working night shifts, and shortly thereafter started to experience some pretty intense sleep disruptions, and the sleep disruptions caused me to start developing panic attacks, and then this vicious cycle ensued where I was having uncontrollable panic attacks and anxiety, and my sleep was getting worse, and the lack of sleep was again causing more panic attacks. I felt like I couldn't function at work. I had to leave my job, and so I did leave my job and ended up seeking more mental health care at that time. This story goes on for quite a while, and this video isn't about sharing my whole story, but I do want to emphasize that my traumatic experience may be very different than others' traumatic experiences, but no traumatic experience is the same, and they are all valid. So what I have really learned is that the mind remembers what the body experiences, and the body experiences what the mind remembers. And the mind remembers things on a very deep level, even on a subconscious level. So even things that may have happened when we were very young, and maybe we can't pull those memories, but our mind is holding those. And I do believe that the body experiences what the mind has suffered and what the mind remembers. And I do believe that the body is the mind, and the mind is the body. And this is where I bring in integrative medicine, because oftentimes conventional medicine still really separates what's happening up here with what's happening here. And what we are really learning more of is how it is also interconnected. And we call this field psychoneuroimmunology, as well as integrative medicine. So briefly, what happens when someone undergoes a traumatic experience like I did, or perhaps one of the many other traumatic experiences that I enumerated? Well, what happens is that we release a stress response. We have a fight or flight reaction, and that might happen suddenly, like like, oh my gosh, I was almost hit by a semi. That was close. And my heart's racing and pounding, and my kids were in the car, and I'm just flooded with this intense amount of adrenaline and cortisol, my stress hormones. So that would be what we call an acute, abrupt stress response. But the more insidious type of stress response that we have from perhaps unresolved stress or trauma is what we really see takes a toll on the body. And this would be something like an event that happened, and we are still, our body or our mind are still processing the circumstances of that event. And this essentially causes what we call a catecholamine cascade, or this downstream effect of stress hormone. And this this causes the body to suffer many things with long-term amounts of stress hormone just circulating through the body, cortisol. So this can lead to things like insomnia, or irritable bowel syndrome, or migraines, chronic pain, fibromyalgia, OCD, problems with fertility and one's menses, decreased immune system and increased vulnerability to infections, thyroid disorders, neurological disorders, weight gain or weight loss. We do know that there's a positive association or statistically significant association between high levels of circulating cortisol in the body and increased deposits of fat in the body. Cortisol inhibits the body to, generally speaking, break down and metabolize fat well. So we also see fluctuations in folks' weight related to their stress. And this may, for many people, become a concern with being overweight, but also depending on the stress response, some folks will lose unhealthy amounts of weight and have no appetite and become malnourished from the lack of nutrients. We see also things like palpitations and heart problems and increased deposits of cholesterol in the vasculature around the heart, and leading to early cardiac disease and heart death. So the downstream effects of cortisol are substantial and significant, and we see them every day, all day, in primary care, urgent care, ER, and in so many other fields. But the good news is there's something that we can do about it. When we have knowledge, we have power, and what I really love to do in my profession is empower my patients to understand that mind-body connection, and understand that these cortisol levels are often driving these situations for which they're seeking care, and that if I can help them and support them in reducing their cortisol levels, we can often reverse many of these situations, these symptoms, these problems that they are experiencing. And so how do we do that? Well, we decrease cortisol in many ways, but one of the most pivotal ways that we can do it is by increasing serotonin. So if you increase that happy hormone in your brain, as we call it, serotonin, we can decrease our cortisol. And there's different ways to achieve this. One of them is, a really important one, is sleep. So when we sleep, our body decreases its production of cortisol, and it is able to make more serotonin. And sometimes folks will say, well, I can't sleep, Pavla, because my anxiety is just so bad, or I'm just suffering insomnia. And that's when I see like this vicious cycle happening, and I want to support my patients in getting good sleep, because I know that that's going to be so integral in the rest of their healing process. And we can achieve sleep sometimes with doing things called sleep hygiene or cognitive behavioral therapy with a therapist, and sometimes with supplements or herbs, but oftentimes we also need temporary sleep aids, either over the counter or prescription, just temporarily to get out of that vicious insomnia and cortisol cycle. Another thing that we can do to increase our serotonin and decrease our cortisol is exercise. So when we exercise, we release those happy hormones, endorphins, and we make serotonin, and all of this reduces cortisol. So I know a lot of people think of, oh, well, exercise is just so I can lose weight. Well, that is a positive aspect of exercise, but for me personally, probably the greatest effect for exercise for me, and what I see in many of my patients, is that decreased cortisol response. Laughter, surprisingly, but also wonderfully, can also achieve a similar effect as exercise, as can being surrounded by a good supportive community and sharing your story with those that you trust, like a therapist or a friend. Perhaps engaging in professional therapy and doing something called EMDR, trauma-based therapy. Nutrition plays a critical role. What we eat can actually help our body maintain a healthy stress response, decrease cortisol, and increase serotonin. Certain supplements can help with decreasing the stress response. Some of these you may have heard of before, but 5-HTP, St. John's wort, amino acids, lavender, so many of them, and also alternative medicine modalities such as Reiki and massage therapy can be very beneficial. Sometimes we need prescriptions, and there's absolutely no shame in that. I think of prescriptions as being, for some people, like a life vest. You're out in the ocean, you've been treading water for a long time, your body is just exhausted and fatigued, and the prescription is there to function as a life vest to help you stop treading water so that you can start making increased amounts of serotonin and decreasing your cortisol. Some folks find that being on a prescription medication for their anxiety or their depression is something they need to be on for life. And again, there is zero shame in that. Then other folks use it just temporarily. Sunshine is really key in helping the body mitigate the stress response, as is removing ourselves from toxic situations, whether that be a toxic work environment or being bullied by somebody in the workplace or in your place of worship or in school or other environments. Setting boundaries is really critical, learning when to say yes and when to say no for the sake of your own physical well-being and mental health. Addressing pain. If you have chronic pain, that can potentiate and increase the stress response, cortisol, but also unchecked cortisol can generate more pain. So again, that's a vicious cycle, and it's important to have somebody who's willing to help you get your pain under control to stop that vicious cycle. And lastly, I would say probably the most important thing is just having a medical team that believes and understands and recognizes the role that trauma and the stress hormone cortisol play in your overall health and well-being, and will support you and advocate for you. So that was the end. That's the end of my presentation. Again, I'm sorry I had to speak quickly on that, but it is such a broad topic, and I was only given 15 minutes. So if you do have more questions, or you want to learn more about ways to treat anxiety or depression or insomnia naturally, please check out my blog that's located on my website, hearthsidemedicine.com, under patient resources. Thanks everyone. It was a real pleasure to be invited to speak at this wonderful conference. Take care. Bye.